Okay, good morning, doctors, nurses, and pharmacists. I'm DrChe, and today we will discuss some important OET writing tips. And we will discuss complete case notes. We will write a letter, and at the end, we will discuss your letters. I will provide the feedback on your
OET
letters.
class.
Okay, please mute.
OET class.
Please mute. Please mute. Yeah. Okay. So, first of all, before we start writing, you need to see how much time you will have in the real exam to write the letter. In the real exam, you will have a 5 minutes reading time. In this time, you will have your case notes in front of you, and you will not be able to write anything. Okay, even you will not be able to pick the pencil in your hand. Okay, so these 5 minutes are just to read the case notes. Okay. So can anybody tell me what you can do in these 5 minutes? What you can do in these 5 minutes? Can anybody tell me how you can avail these 5 minutes at the start when you will not be able to write anything? What you can do? Yeah. So read information, someone is saying. Read information, read the case notes carefully, underline important information, just read. Is not just read, is also plan in your mind what you are going to do, how you are going to organize the letter, what information is important, what information is not important. These things you can plan in your mind before writing a letter. Okay. So just quickly read the letter and see what is important, what is not important, what kind of this letter is, referral, discharge, what kind of this letter is, and then start, organizing in your mind how many paragraphs you will write and which information is important, which information is not important. Okay, these 5 minutes. Okay, you can also unmute and you can talk with me. Okay, so when you start reading in these 5 minutes, you will not start reading like this. Okay, starting from here and ending at at the end. You will not read the case notes like this. Okay, how you will read the case notes? Can anybody tell me? Yeah, range relevant, semi-relevant, irrelevant information. Yeah, that is good, Dr. Ahmad. So, you will read just this part. Your doctor nurse at this hospital, read the case notes, complete the task, okay? Just quickly. Then go to the end, okay? Read the task before you start reading complete case notes. Read the task, okay? The task is using information in the case notes, write a letter to patient's GP, DrChe, give brief history of admission, treatment, and discharge plan. Write letter to this is the name and address of these things. Okay, so even you don't know the case notes, but from this information that is given in the writing task, what comes in your mind? Can anybody tell me? You can unmute and you can. Yo,
Yeah,
yes.
it is the discharge letter, I think.
Yeah, is discharge letter. Yeah, number one, it is discharge letter. What else? Sometimes you are writing discharge letter at the same time you are sending this patient to another specialist.
Yeah,
That is kind of discharge plus referral, okay? But this kind of
yeah.
discharge letter is back to GP. These things are important if you're sending the
Mm-hmm.
patient back to GP. That is important. You know why? Why it is important?
Because GP also
Yeah, there
because
are
GP also
yeah, there
because
are
GP know
yeah, yes,
all
doctor.
the history about
Yeah,
all
the
the
past
about
history,
the
previous
patient.
history, these
Yes.
things GP already knows. GP is a doctor, a family doctor of a patient. and they have the record of the patient for a long time, and they know most of the things about the patient, especially past medical history, any chronic uh, disease, these things. Okay, so it's important to keep in mind that you are writing this letter to a GP. Okay. Okay, what else is there? Nothing. Okay, so yeah, then you need to move to quickly. These things you need to do quickly, just as I'm explaining. That is why it is taking time. Otherwise, you will do it quickly. Okay. So name is given here, address, gender, date of birth of the patient, age. So both of these things are given. You will write one of them, age or date of birth. Okay, in the greeting part. Admission date is here. Discharge date is here. So it is understood that this is a discharge letter. Diagnosis here I have written subdural hematoma, and later on I have written epidural hematoma. So if you write any of those, it would be acceptable. Okay. Here I have written subdural. These are my own case notes. So later on I have written epidural. So you can write both of them. Is okay. I will accept it. Mostly in the real exam, these things will not happen. They will make everything clear. Okay. Then is social background of the patient, forklift driver, works in shifts, married, okay, lives she has two daughter, live other state, okay. Still, you don't know this social history is important or not, okay. Even it is discharge letter, it could be important. So still, we cannot decide if it is important or not, okay. And his cigarette smoking, alcohol drinking moderately, weight of the patient, past medical history. Sometimes you are writing a discharge letter, but the patient has some social issues where you are sending back the patient to the home, and the patients are having some social issues. Okay, there is no one to take care of, and these things. Then social history is sometimes important. Okay, so you will decide according to the situation of the patient. Okay, what kind of letter is okay. Past medical history patient has hypertension, appendectomy, and TIA, transient ischemic attack. And family history, father died of colorectal cancer, and mother uh, has hypertension for the last 20 years and takes ramipril. Okay. So this is still we don't know what is important, what is not important. We're just giving a quick overview. So this is when the this is date when I have written these case notes as just to tell you that I'm not a new OET teacher. I have been teaching OET for the last 5 years. I started in 2020, and these case notes I have written in 2022. Okay, so if you see the date of 5th of November 2022, this is the main visit. But you will see I have subdivided it into three parts, okay? Yes or no? Something that is happening at 10:30 a.m. in the morning. Then I have written the situation of the patient at 10:50 in the morning, and then at 1 o'clock, okay? Three times. So what comes in your mind about organization? Just let us just give a quick read, okay? Then I will explain these things. So, patient had a hand injury while playing this snowboarding. There were loss of consciousness, weakness. These things you will do very quickly, okay? As I'm going to teach you, that is why I will go slow. Okay, slurred speech symptom lasted for 10 minutes. Okay, and it was I witnessed by athletes participating in the competition, and after 20 minutes at 10:50. Brought to hospital by ambulance with moderate headache, no weakness in arms, legs, no slurred speech. This is the examination. Vitals, okay, vitals given here. And There was a bruise and there was no bleeding. Then at 1 p.m., patient became unconscious and was unable to move. Okay, and I have written something in the bracket. Is this is something important? I will tell you while writing letter. Okay, this is the examination. This is the Glasgow scale, and this is the investigation. Okay, investigation and what we have done for the patient. Okay, treatment. Then you have next visit. That was on 5th of November, and this is next assessment of the patient on 10th of November. Patient is recovering well, shifted to medicine department. There is weakness in left arm and leg. Weakness in left arm and leg has improved and is able to, okay, walk with stick and assistance of nurses. Okay, vitals are normal. Then there is next, assessment on 15th of November, and patient was referred to rehabilitation department. Okay, and they have made some individual plan, speech therapy, language therapy, and was able to walk and but not able to do daily life activities. Okay, so this is the examination and this is the plan. Okay, so what you have done at that time. Okay, what you have planned for the patient at that time. Okay, 19th of November, clinical stable, able to do daily activities independently. So you can see the patient is not socially dependent now. That is why the things will change. Okay, and this is the discharge plan. So what is your discharge date? It is already written at the start.
It is 19.
Yeah, the last visit is mostly a discharge date or the date that you will write in the letter. Okay, and in the discharge plan, you patient have to continue aspirin 75 milligram, physiotherapy, and there is some advice to stop smoking and decrease weight, and this is advice about when the patient can resume his or her work. Okay, now you have to decide. This is just still first 5 minutes of reading time. Okay, you have to decide which information is important and which is not important. Okay, you are writing back to GP. Do you think this she is a forklift driver and married and family history, smoking, drinking, and a personal history of hypertension, transit ischemic attack, and family history? These things are important or not to mention for the reader?
I don't think it is
No,
not
these are not
important.
important
So why these are not important to mention to the reader
Because
of this letter?
because it's already
the
know about because GP know about our social history, medical history.
Yeah, that is good. If I change the same letter, if I change the same letter just a little bit with with some changes, and if I remove this treatment and investigations and just I write what happened to the patient at 11:30 a.m., then 10:50, and then what happened at 1 p.m. at your GP level. Patient came at GP level, became unconscious, and you have given the oxygen and blood pressure was this, and then you have referred the patient to the tertiary care or to the specialist, neurologist. Okay, this is referral letter now. So then you think this social history, past medical history is important or not?
yes, definitely important.
So why now it is important?
Because we are sending it to the specialist, and the specialist usually don't know about the like. He's the new to the specialist, so he
Yeah,
need to know about the social background and his history.
yeah. Further, the patient got some bleeding in the brain. Okay, and a patient need to know, the doctor need to know the risk factors. The risk factors could be in social history, past medical history, and these things. Okay, and even family history is also important. Okay, so the things change according to the situation of the patient. So that is why you don't need to memorize the letters. Okay, and you just need to know how to manage the situation. In the real exam, you can get any kind of letter. At the end, you should be able to write. any kind of letter, okay? So next thing is, so it is now clear that your first part is not needed. Social background, past medical history, family history, these things are not needed to write, okay? Now we have only visits, okay, and discharge plan. In the visits, in the first one, you have when the event happened, you have 5th of November, you have three times 10:30, 10:50, and 1 p.m. three times, okay? And then you have patient's condition on 10th of November, and that is improvement. And then you have moved the patient to the rehabilitation department. And there are some important things to mention in this department, this visit. And today's visit is not important. I mean, there is nothing important like as a visit, but you will write the discharge plan here in the last. Okay, what you need to do for the patient after the discharge. Okay, because this is important for the GP. Now, before you start writing in the real exam, you need to plan. Okay, do you think you are going to write all of these timings of the first visit, means of the first date, 5th of November, together in one paragraph? Yes or no?
Yeah, yeah. I think we can write in the one paragraph.
We can write, but do you think it will be a normal paragraph or it will become long paragraph?
It will like we can minimize this one. Yeah, I think.
You can minimize, okay. Yeah. So I would prefer to write it in at least two parts, okay? In two paragraphs, okay. This first one, this first one, uh, of 10:30 and 10:50, when patient is still not serious, you can take these two together to write one paragraph, okay? And then we will write one paragraph. It is still here, okay? These are two times, okay? We will join them together, and then here the patient's condition is becoming serious. So there is a treatment, there are investigation, there are vitals, okay? There are symptoms also, just like a complete visit, okay? So we will be able to write a complete visit for this time, okay? So we will write two paragraphs here, and then what do you think? Can we write one paragraph for this 10th of November? We can write, but there is nothing too much important. Just patient's condition was improved, okay, and was able to move with a stick and assistance, okay. So you can join this one with the next one, okay, this paragraph with the next one, okay, and then you can write, or you can, if you want, you can write separately also. You will write the last one, discharge plan, okay, discharge. So this is how you will organize your letter, okay. Any questions so far? Any questions so far?
No, I think.
So, so let me just read 200. How many words in one paragraph? No, there is no limit of number of words in one paragraph. But one of sub criteria in OET writing is paragraphing. So you should organize the letter wisely so that you have uh, you know uh, paragraphs of almost equal length. There is should not be one paragraph or 100 words, other paragraph of 20 words. It should not be happening. Okay, so you should divide and organize according to the so that all the letter looks good. Okay. Okay, so now we will start writing. First of all, you will write the greeting part. Okay, so greeting part is very easy. Just go to the writing task. Okay, this part you will see one comma here, one comma here. All the things that come after comma, you will write in a separate line. Okay, DrChe in first line, GP, general practitioner, next line, GP surgery, you can write also, but you can skip it also. Then you will write the address and then name of the city. Okay, all words should be capital. Okay, let me show you. I have already written. You don't need to waste time for this. DrChe, general practitioner, GP surgery, 80 or 30 Greenberg Street, Manchester. Okay, so you will write them on separate line. Mostly they are separated by comma. So whenever there is comma, you will write the next part on next line. Okay, DrChe on first line, GP practitioner on next line, GP surgery next line, and then address and then the name of the city on next line. Okay, then you will leave one blank line. We need one blank line before date and one blank line after date. And this date here, date should be today's date. Okay, the last visit's date, today's date. Okay, for example, when I am writing this letter, for me at that time, today's date is the DrChe date. Okay, that last visit date that was 19th of November. Okay, so you will write that date here, 19th of November. You can write 19 November also. You can write 19th with TH also, November. And then one blank line before and after date, and then you will write dear doctor, and here you will write the not the complete name of the doctor. You will just write the surname. Okay, for example, if I write my name as for example, let me just write as for example, if I write my name as dear Dr. John Che. Okay, for example. So what you will write in the greeting part is dear Dr. Che, okay? Because you will write the surname. Surname that comes at the end, okay? The second name. If I change, if I write Che first and then John, then it will become dear Dr. John, okay? So you will write dear doctor. If the name is not given, you can write dear nurse, dear doctor, dear sir, madam, like this, okay? Then you will write the patient about the patient regarding Miss Emily Brown and age, okay? You can write the date of birth and age. When both of these things are given, I mostly like uh, age, because age is a little bit more good for me to quickly have an overview, okay, how old is the patient. But you can write date of birth or age, okay, one of these things, okay. So next is, now you will start writing your letter. Okay, so when you will start writing letter, so first you will write purpose, and at the end you will write conclusion. Okay, conclusion. Okay, so purpose at the start and conclusion at the end, and the last there is one sentence, that the ending sentence, you can say ending sentence, and the at the last is just greetings. Okay, that these things are fixed. Purpose and conclusion, these things are fixed. Okay, so then you have two or three paragraphs. Okay, two, three, four paragraphs that you will write in between, okay? So next thing is how you will organize the letter. So there are two things that you do. Number one is chronological order. Number two is order of importance. Chronological order is you write initial visit first, next visit next, then next visit, then today's visit, and then you conclude the letter. That is a chronological order. Mostly in discharge letters, in non-urgent letters, you organize like this, okay? And when the letter is urgent, like patient is having unstable asthma, patient is having, you know, something acute, like myocardial infarction and these things, then you need to write the most important visit first. So mostly after purpose, we write today's visit. That is the most important visit mostly, okay? So it depends upon the situation. What order we will follow in this letter?
Uh,
Chronological or order of importance?
I think chronological is the best because the patient is becoming stable and he's discharging now.
Yeah. So here we will follow chronological order. So for our initial visit and then next visit and next visit. Okay. So first we're going to write a purpose. Okay. As mostly we have typical style in writing purpose. That I am writing to refer, and if you go a little bit more advanced, you can write thank you for accepting, thank you for seeing. So these things you will learn with time. Okay. The main thing is how to what things we need to write in the purpose. There are two important things that we need to write in the purpose. Number one, what is wrong with the patient? Mostly that is the diagnosis. And number two, what we want from the reader to do for this patient. Okay, it's very easy here. For example, what is wrong with this patient? You can write epidural hematoma or subdural hematoma, whatever. It was written here. Yeah, the diagnosis is written here, epidural hematoma, okay? And it is written here also at the start, diagnosis subdural hematoma. So you can have one of them, subdural, epidural. It should be same at both of these places, but you can write subdural or epidural hematoma. This is your diagnosis, okay? And what we want from the reader to do for this patient, where it is written mostly in the writing task, okay? So here, if you see, uh, write a letter to GP, give a brief history of these things, and sometimes written in the discharge plan. Okay, so the GP need to continue the treatment of this patient. Okay, continue aspirin, physiotherapy, and these things. So it is written. It is clear that this is for the follow-up care, further care. Okay, so how now we will write a purpose. Okay, it's very easy. I am writing to. Here we will not write refer. Mostly when we are writing back to GP, we can write update. Okay, I'm writing to update you. We're writing to update the GP on patient's condition. I'm writing to update you, and then you will write on. I'm writing to update you. You can say regarding also and on also. On Miss Brown. Here you will just write the surname. Okay, Brown. You can write the age here also, and you can skip a 52-year-old, and then you can write the profession of the patient or the gender, these things. But as my letter is a little bit long, I will try to avoid it. Okay, I will not write the age here because there are a lot of visits in this letter, so I'm going to skip this part. But if you want, you can also write. Okay, so then what is the what we have done for the patient is a patient was treated in the hospital for epidural hematoma. Okay, so the best thing that we mostly I write is who has been treated for epidural hematoma. Okay, if you see here in the case notes, I have written epidural hematoma in capital. Okay, So, so this epidural hematoma is written in capital, okay? So you know why? This is a diagnosis and it is written in capital, but you write the diagnosis in small if the name is general, like pneumonia, like it is, uh, what else, like pneumonia or, diabetes, you write in small, okay? If the name of a disease is given after someone's name, like Parkinson's disease, Alzheimer disease, you will write the first word capital, okay? Alzheimer down, you will write capital. So here, the reader will not give you all the things in hand, okay? So I have written in capital. Some of the student can write it wrong, okay? They will write epidural hematoma capital. That would be a mistake, grammatical mistakes, okay? So you need to write it in capital, in small, okay? Epidural hematoma should be in small, okay? If the name of the disease is given after someone's name, like, you know, Parkinson disease, Alzheimer disease, then it is capital, okay? So I'm ready to update you on Miss Brown, who has been treated for epidural hematoma. Next, we need to write, what we want from the reader for this patient, follow-up care, further care, okay, after discharge, okay. So mostly the typical style is like this. This is typical OET style, okay. She is being discharged today and your follow-up care, further care, your follow-up care would be highly appreciated, okay, like this. Done? Now let us move quickly to the first visit. As I have already told you that I will write these two visits, these two timings together, okay? In one paragraph and next paragraph, I will write this one, okay? So we need to see, you cannot write each and everything because your letter will become, almost too long, like 500 words, okay? So what you need to do is you need to see where you can make it concise, okay? Head injury while playing snowboarding, loss of consciousness, weakness in left arm and leg, slurred speech. All symptoms lasted for 10 minutes and it was eyewitnessed by the athletes. Eyewitnessed by the athletes, you can skip it, okay? And patient was brought to hospital by ambulance at this time and there was a moderate headache. There was no weakness in arms and legs. There were no slurred speech and the vitals were normal. You can see saturation normal, blood pressure is normal. Temperature is normal, pulse is normal. The only thing here is a bruise of 5 centimeter was noted on the right parietal region. Okay, there was no bleeding. Okay, so you don't need to write each and everything, otherwise this paragraph will be too long. Okay, so what you can say is on this date, and then here you need to write time. Okay, with date you will write on this date, and with the time you will write at this time. Okay, on this date at this time, okay, you will use commas to separate them. Miss Brown, uh, how you will start? You need to write the injury.
Um,
Yeah,
Miss Brown had a head injury while
yeah,
playing snowboarding.
yeah, yeah. You can write like this. Yeah, had a head injury, while playing snowboarding. Okay, okay. Then next thing is she had no loss of consciousness. There was weakness in the left arm, and slurred speech, and it lasted for 10 minutes, and it was witnessed by athletes. But witnessed by athletes, you can skip it. Loss of consciousness, you can mention, is a little bit brief, but uh, you can, if you want to write a little bit in detail, you can write like this. She had a head injury while playing snowboarding, and comma, she lost consciousness and had weakness in left arm and leg, slurred speech, uh, you know, uh, and these symptoms lasted for 10 minutes, okay? But this is not a concise way, okay? What you will say is, let's try to write, okay? So if you write all of these things, it will become too long, okay? So these things are difficult, okay, in the real exam. Here it looks a little bit easy because you are not in the exam condition.
Mhm.
On this date is 05/11/2022 at 10:30 a.m. So always remember, okay, with the time we use at and with the exact date we use on, okay, is important. These things are not important for us, for doctors and nurses, because you were just mentioning the time and the date. We can mention with the at, in, on. That is not a problem for us. But as this is English exam, we need to be, grammatically accurate. Okay. Miss Brown had a head injury while playing snowboarding. Okay. What else? So these symptoms are mostly, weakness in one part, and these things, you can write as hemiplegia. So you can, she
She was unconscious.
she lost
You can write
consciousness, or she was unconscious. She lost consciousness. Both are okay. Consciousness and had hemiplegia, which lasted. So you need to mention timing here also, which lasted for 10 minutes. Okay. Okay. Done. So this is the only important thing from the first, visit, from the first time. Okay. So let me show you. Sorry. The model answer, live class. These are my live classes that I used to take in 2022. Live class. Okay. So let us see in the model answer a little bit better way, because when I'm writing model answer, so I write, with calm and, so at this time, Miss Brown experienced a loss of consciousness. We need article. Right hemiplegia. So I'm not writing weakness here and there. Just write hemiplegia and slurred speech. Experienced a loss of consciousness. Right hemiplegia and slurred speech, which lasted for 10 minutes after I had injury. So now, if you compare this sentence with the one that we have written right now, which one is better? Almost we have same number of words. Which one is better? The second one, yeah, this one. This is well organized, okay, professional. Miss Brown experienced a loss of consciousness, right hemiplegia, and a slurred speech, which lasted for 10 minutes after a head injury. Okay, so here what we are doing, we are just following the case notes, the order of case notes. Okay, as it is written in the case notes, we are just doing that. Okay, she had, where is it written? Yeah, she had a head injury. She lost consciousness and weakness here and there, slurred speech, which lasted for 10 minutes. These things, okay? So this one is more professional. She experienced a loss of consciousness, right? Hemiplegia. No, I'm using medical terms, okay? Because you are writing to a doctor, you can use these things, okay? Instead of using just weakness, right? Hemiplegia and a slurred speech, okay? Just slurred speech, which lasted for 10 minutes after I had injury, okay? Okay, but this one is not wrong also. So what next? Okay, next you need to write about, about the next visit, this date. In this date, what is important? Still here. She was brought to hospital by ambulance, moderate headache, no weakness in arms and legs, no slurred speech, and vitals are normal. Pulse is okay, temperature is okay, respiratory is okay, saturation is okay, blood pressure is okay. And just we have seen a bruise of 5 centimeter on the right parietal region. Okay, there was no bleeding. There, so there are a lot of information.
Also,
Please mute. Yeah. So there are a lot of things, but what you need to do is you need to write them very concisely, because if you start writing each and everything, it will become too long. Okay. So you will say at this time, and here you don't need to write brought to hospital by ambulance and these things, because your letter will become too long. Okay. At this time, and then what is the new thing in the patient? She had a moderate headache. She had a moderate headache, and there's no weakness and slurred speech, no slurred speech. Okay. Vitals are normal. And on examination, there is a bruise of 5 centimeters. There's no bleeding. Okay. Just imagine, the important thing is how you will write it concisely. Okay. If you need to write all of these things, you can easily write a good 3, 4 sentences. But the thing is how to write concisely. Okay. But sir, I guess nurse can't write diagnosis like hemiplegia. They can write the same words in medical language. Am I right, sir? You can write the same words as in the case notes, but if you are writing this letter to a nurse, the nurse, other nurse, they know what is hemiplegia, okay? But mostly they write the sim name of sim. For example, if you say here, if you see here, the writer have given you clue here. Complete right hemiplegia in the bracket. Okay, this is medical term. If a nurse is writing a letter to another nurse, you can use medical terms. Okay, because nurses are almost like GPs. They know medical terms. You can write medical terms. Okay, even you should write medical terms, because uh, you know nurses know medical terms. But if you are a nurse and you are writing to a community worker, or a layman, then you will not write medical terms. Okay, you will write simple language. Okay. As you have already written that her symptom lasted for 10 minutes. Okay. So we don't need to mention again she had no this and that. Okay. Negative things. Okay. Just mention the new thing. She had a headache. Okay. Vital signs were normal, and examination. Okay. Uh, you can see here 10:30 and then 10:50, we have a gap of 20 minutes. So you can say, instead of just writing add 10:50, you can after 20 minutes, okay? After 20 minutes, okay? Here you will not write name of the patient, you will use pronouns, okay? She started experiencing. So what is the new here?
Moderate headache.
Moderate headache, okay? Moderate headache in right parietal
Mm,
region is important to mention here.
yeah, I think it's important.
You can mention, but as
Mhm.
this is this child letter, imagine how many how many things you have ahead of you in visits that you have to mention. You will mention the complete discharge plan, because you cannot skip anything from the discharge plan. Okay, this
Mm.
is one long paragraph also, and you need to just give a brief, overview of these previous visits. I just headache. Okay, you can mention exactly, but just she experienced a moderate headache. Okay, started experiencing a moderate headache. Okay. And what else is important here? So you
Vitals.
can, yeah, you can write a separate sentence. Her vitals were unremarkable, except, okay, her examination was unremarkable, except for a bruise of 5 centimeter on parietal region. Okay, this is a good sentence. Okay, she started experiencing a moderate headache. Her examination, or you can say vital. Okay, examination was, or you can say vitals also. Her examination was unremarkable. Or you can just write, and a bruise of 5 centimeter was noted on her left parietal region. Okay, except except for uh, a bruise of 5 centimeter was noted on whatever is left or right parietal region. Okay, it's becoming a little bit long. Okay, right parietal region. Okay, so we have 50, almost 50 words just in the initial, 2 times. Okay, so this one we can make it concise. I will see in the, model answer. After 20 minutes, she started experiencing a moderate headache, and her examination unremarkable, except for a bruise of 5 centimeter, was noted on right parietal region. Okay, so what we can do is the same sentence. Let us try to make it concise. You don't need to repeat the word she. Okay, had a bruise of 5 centimeter on right parietal region. Okay, you can see this one is much better. Concise, short. Okay, let us see in the model answer. After 20 minutes, she had a moderate headache and a large bruise of 5 centimeter on her right parietal region. Okay, even I'm not writing here, uh, you know, and had again. Okay, so here I've written started experiencing. Just she had, she and had I am using for the second part of the sentence. She had a moderate headache and a large bruise of 5 centimeter on her right parietal region. Guys, these are small things. These things look small, but these are very important. When you are writing a letter in the real exam under your time pressure, these things are important, and you will not be able to make them concise easily. Okay, it looks easy, but it's not like this. Okay, now here you have 25 words for the same thing. Here you have 19 words for the same thing. And here are also 19 words. I think so. 19 is the same 19 word, but is more organized and more fluent. This part. the last sentence, okay? So we will take this one, okay? Let us remove the model answer here. Now, next is what happened to the patient on next date, okay? Next time, okay? This is important visit, okay? Became unconscious, unable to move left arm and leg, okay? So here, if you are a nurse, you don't know the term. Most of the times, the reader will give you, the examiner will give you a little bit clue about medical terms. I have written right hemiplegia, okay? Problem with movement, right hemiplegia, okay? And in the vitals, pulse is important and blood pressure is important, okay? Other things are almost okay. GCS is important, 9/15, and CT scan showed this one, massive epidural hematoma, and patient was admitted. Where does this say? Admitted to ICU, assessed by neurosurgeon, and bowel surgery was okay. So admitted to ICU is not important because now this is discharge letter and we cannot go into too much, small information. Okay, and this surgery was done by neurosurgeon is not important because if it is, surgery of brain, it will be done by neurosurgeon. Okay, just important is bowel surgery was done. CT scan showed massive epidural hematoma. And at this time, patient became unconscious and had a complete right hemiplegia. Okay, and the vitals is important, blood pressure and GCS. Okay, so let me show you. As we have already the model answer. Let me show you from the model answer. Okay, we cannot spend too much time on in the class also. So it's very easy. At this time, Miss Brown became unconscious and had complete right hemiplegia. Her examination revealed blood pressure of this and a GCS score of this. Her CT scan revealed. So revealed is two times here. Examination revealed here. CT scan revealed here. So this is a little bit, repetition. So you should use another word. What word you can use?
Her CT scan shows.
Showed. Okay, very good. Okay, very easy. Just showed. Okay. CT scan showed a massive epidural hematoma and a burr surgery was done. Very concisely, okay? Don't write too many things, okay? So next is now this again, this looks very easy, but
Instead of showing, we can use the word indicate. Is that fine?
yeah, indicate is also okay.
It is can indicate.
Indicated, revealed, showed, okay? Yeah.
Thank you.
So next, this visit is very brief, okay? Just one or two things. You cannot write a separate paragraph for this. If you write a separate paragraph this, it means you don't know how to do the paragraphing, okay? So on this date, patient's condition improved, okay, and was shifted to medicine department. Weakness in the left arm and leg improved, okay, and was able to walk with a stick and help of nurses, okay. So just make it concise. You will write just one sentence on this dates. As you are writing next paragraph, you will use Miss Brown, okay. On this date, Miss Brown's condition improved, okay. Even I'm not going to write she was shifted to medicine department, okay. No, there's no need, okay. On this date, Miss Brown's condition was improved. Okay. Uh, uh, okay, it's just movement. Weakness in left arm and leg improved. Okay, we can do like this. On this date, Miss Brown's condition improved as her weakness in in left arm and leg improved. Okay, and her weakness in left arm and leg improved. No, improved is two times again. Okay, you can just improve it. Okay, improve third time. I said the improve third time. Okay,
Uh, Sir, we can write like that.
yeah. What you
Her
can write?
condition has been improved. Her condition has been improved, and
Yeah.
weakness in left arm and leg showing 4 by 5.
Uh,
And she is able to walk with stick assistance of stick and
Very
nurses.
good. Very good. Are
So
you a nurse?
yes, sir, I'm nurse.
Yeah.
I think vitals. We don't need to write the vitals here because we
Vitals are
already
not
have told
important.
them
Okay.
about
Okay.
vitals.
What about your tens?
Sir, I have told that all things in sentences.
No,
We will
tens,
write like that.
tens. Which tens you are using when you have told about this
Past
visit?
tense.
Sir, we are using.
You
No,
you
sir,
told
we
me
are
in the
telling him
present
in
tense,
present
okay? Present. But it's
present
wrong,
tense, sir.
okay?
We are telling the
Present is
present
wrong.
condition.
Yeah. Is wrong. This is a past visit.
Okay, 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 okay,
Yeah.
okay.
This is
Got it.
this is the big mistake, okay? This is a common and big mistake, okay? When I am writing
Okay, sir.
when I am writing this visit, I'm for the case notes I'm writing like on that date, okay? Okay?
Okay, sir.
Yeah. I
Oh,
can use present tense here in the case notes, but for you, when you are writing, for you, this is a past visit because you are now at the discharge date, okay? You will not use present tense. This is a common mistake,
okay,
okay? So, yeah. So use past tense, okay?
okay.
But overall, it's good that you have told is good. Just use past tense, okay?
Thank you. Thank you, sir.
So, just one sentence for this complete visit. If you see here, just one sentence. On this day, Miss Brown had less weakness and was able to. Even I'm not writing 4 by 5, 3 by 5. Even I'm not saying her condition improved as her weakness improved two times. As I already told you, okay, I'm not just memorizing this before taking the class. These are my own case notes, and this model answer is written by myself. Okay, but as you are like naturally just doing like a student, so her condition improved. Just mostly we write like this. Her condition improved as her weakness in the left and right, leg improved. Okay, you can see how long this sentence is. On this date, Miss Brown's condition improved as the weakness in her left arm and leg improved to, even you can improve to 4 by 5. Okay, so very easy, Jeff. Miss Brown had less weakness, means her weakness was improved. You can write like this, okay, and was able to walk. When you are saying was able to walk with a stick, it means you are telling that her, you know, movement is 4 by 5 like this. Okay, is good. Okay, was able to walk with a stick and assistance of nurses. Okay. Okay, so I'm in my hospital, so just talking with staff also. Okay. Okay, so done. What we were saying, okay. Miss Brown had less weakness and was able to walk with a stick and assistant of nurses. Okay, done. Okay, now let's move to the next. Okay, you can improve these things by yourself with practice. These things improve with practice. Okay, and with uh, you know. So next is Patient was referred to physiotherapist. Was referred to the rehabilitation department. Shifted to the rehabilitation department. You can also say they have made some individual plan, okay, by the occupational therapist, and speech and language therapist was also. Patient was able to walk independently and but was not able to do daily life activities. Okay, examination is normal here. Everything is normal. Movement is normal, and we have advised the patient to continue physiotherapy until physio. I written the word physio here. You will write the word physio because this is wrong to write in the letter physio. You need to write complete word physiotherapy. Okay. Okay. So now this we have written this like this. 5 days later, she was referred to rehabilitation department where she was able to walk independently and her muscle strength was improved to 5 by 5. Okay, good, done. Now is the last thing. Today's visit discharge plan is important. Telling the GP that patient should continue aspirin 75 milligram once daily is important. We need to write the dose and the frequency and everything. Okay, tell about the physiotherapy twice weekly, and tell about the advice to stop this and that and when can resume work, because these things you cannot skip. You can make them a little bit concise and good and well organized, but you cannot skip any of these information because all of them are important. So just let me show you from the model answer very quickly. Miss Brown's condition, even you can add today. Today, Miss Brown's condition has improved. Even I have written today here. Okay, Miss Brown's condition has improved today as she can do daily life activities. Okay, this is important to tell that she can do daily life activities because after discharge she will not be dependent on someone else. It's important. Okay, and is being discharged on aspirin. Aspirin is written small because this is generic name. 75 milligram once daily. She should continue physiotherapy at the local rehabilitation center twice weekly. Please advise her to stop smoking and decrease weight. She can resume her work after evaluation by an occupational therapist. What some students do is they write all of these things together in one sentence. It becomes a little bit very confusing for the reader to understand. Okay? But you have to make things easy and clear for the reader to understand in OET. Okay, the conclusion is very easy. I would be grateful if you could further take care of Miss Brown because your letter is already long. Okay, these are exactly 220 words. Some of you are asking how many words we should write in OET. Mostly they write in their official letters up to 200, but originally it is acceptable because there are many letters you cannot, finish in 200 words. So up from 180 to 220 is acceptable. From 180 to 220, but you should not write any irrelevant information. Okay, and be concise and and don't skip any important information also. Okay, any question? Then I will mark any letter if you have sent me. I will mark. Okay. So any question so far? Dr. Aman is there because you have sent me the letter. Any of you have written letter? No. Okay. Next time, whenever there is writing class and I send you the case notes, you can write a letter and you can send me for the feedback. Okay. Was improved is okay. Grammatically is okay. Was improved. So you can still send me letters in next 6 hours for the feedback. Okay. Because this is first time we have resumed our classes. You can send me the letter in next 6 hours and I will try to give you the feedback. Okay. So now let us mark this letter, the one letter only that was sent me by our Dr. Dr. Aman. Yes. What is your question? You, every day, I will update you in the my WhatsApp community when I take the next class, okay, and what this class is about, okay. Model answer, you mean? No, you will send me the letter on my WhatsApp number. I have sent you the WhatsApp number in the community, okay? That is there. So you can see this is Dr. Amon's letter. Just let us read it quickly, okay? We will not spend too much time. Date is at the start. It is not wrong to write the date at the start, but it should be in the center, okay? And we need to leave one blank and before and after date, okay? GP surgery, you can see GP surgery and general practitioner, these two things are written on the same line with a comma. This GP surgery should be on the next line, okay? There should be no blank line between there, Dr. Che, and regarding this patient, no blank line here, okay? I'm writing to update you regarding Miss Brown, who has undergone bowel surgery due to subdural hematoma. Is also okay. She has undergone bowel surgery due to subdural hematoma. It is okay. I have written who has been treated for, subdural hematoma. Okay. And this student has written who has undergone bowel surgery due to subdural hematoma. That is okay. The main thing is you need to mention what was wrong with the patient, what was the diagnosis. Okay, she is now ready to be discharged and will follow up with you for further care. She is now ready to be discharged. This part is okay. And what do you think about the next part? Will follow up with you for further care. This is professional. Looks professional or no? Does not look professional. Okay. This part it needs improvement. Okay. I have already shown you how we can improve. Initially on this date. The time is not written, okay? Now I is writing at this time. Miss Brown presented with complaint of moderate headache at this time, okay? So let me tell you, maybe this doctor is writing the letter for the first time. They have don't have a little bit idea, but when you write a letter, it should be like a story, as we say a story to our kids, okay? Just once upon a time, there was a king, there was a queen, like this, like a story, okay? And if you see this doctor's story, this story starts with a headache, okay? At this time, was the issue headache the main issue? No, headache. The main issue was head injury, okay? And this doctor has not written what happened at 10:30, okay, at the first. Please note that she has history of. Just quickly, okay, just give me 5 more minutes, then you can leave the club. Okay. She has a history of loss of consciousness, weakness in left arm and leg, and slurred speech, followed by head injury while playing snowboarding. Okay. I will not say it is wrong to say she has a history of this, but mostly in OET style, in medical style, we write history when something is in the past, okay? But this thing just happened 20 minutes ago. It looks very, strange, and it looks that this doctor is not aware of OET style, okay? Yeah, it should not be she had a history. It should be like she had a head injury and then she lost consciousness and these things, okay? And then after 20 minutes, she had a headache and her vitals were normal, like this, okay? Please note the episode of symptoms last for 20 minutes, okay? Grammatically, this is wrong, okay? It should be past tense, okay? Lasted for 20 minutes, 10 minutes. And we cannot write a separate sentence just to tell that the episode lasted for 10 minutes. It should be adjusted with the symptoms, okay? These symptoms lasted for 10 minutes, okay? So this, you can see people, this is the conciseness. Today's visit, we can use present or past tense. Both are okay, Ali, Dr. Ali. So no, it for me, if I'm examiner, just by reading these two or three sentences, I know that this doctor will not get B grade, okay? C or C plus, okay? So this duration should not be in separate sentence. It should be with, very concisely written with the symptoms, okay? On examination, there was a live bruise of 5 centimeter on parietal region. Again, just one sentence, simple sentence. At this time, she became unconscious. She became unconscious is just one sentence, very short sentence. This is not good. Okay, you should be very organized. There should be a little bit long sentence. You should join information together. Okay, on examination, BP and pulse rate was raised. Okay, BP and pulse, these are two things, and the student is using was is wrong. Okay, and was raised is raised. What you mean by raised? Just write what was the BP, what was the pulse. Okay. Furthermore, in OET, we don't use furthermore, moreover. Just you can use in addition, additionally, also like these words. Okay. Our GCS was 9 by 15. With a complete right hemiplegia, CT scan of the head showed right hemiplegia. Just one sentence, nothing, just simple sentence. Okay. She was admitted to ICU and bowel surgery was done by neurosurgeon within 24 hours. These things. What about conciseness? I only want to talk about conciseness. Is there any conciseness in this paragraph? No. We need to improve conciseness. We need to improve, paragraphing, conciseness. We need to be very professional, more formal, well organized. Okay. On this day, Ms. Brown showed a satisfactory recovery. Just simple, again, simple sentence. On examination, her power was 4/5 in left arm. And next page. Okay, she was shifted to medicine ward. Medicine ward and this shifting is not important. On this state, Miss Brown was referred to rehabilitation department for physiotherapy. Again, simple sentence. This doctor is written very simple. After 3 days, she was able to do all life activities. Again, simple sentence. In view of the above, it would be highly appreciated if you could further manage her. Again, simple sentence. Okay, her discharge plan includes aspirin and aspirin dose frequency, these things are not written. Okay, just aspirin. How the GP knows how much aspirin I give? If the GP like me is just giving OET classes, they don't know you know recent guidelines. So how they can know? Whenever there is discharge letter and you need to continue the medication after discharge, you have to write all the details about that medication. Okay. And the plan include aspirin and physiotherapy. Please advise. Her advice is wrong. Advice is known. We need to write here. Advise with S. Okay. To stop smoking and please and decrease weight. And she may resume work after 8 weeks after evaluation. So what should be score for this letter? What should be score for this letter? Just quickly, please, in the chat.
So
Just
you can,
this is the
so
last.
you can tell this.
Yeah, I can
You
do,
can,
but you have written, you have seen the model answer. You
sir.
have
I guess all language is not showing professional
yeah,
language. This is very simple language, and
yeah,
as we are talking like a simple with other one, but it's
yeah,
not seems like professional language.
yeah, yeah,
So many times she used a word please. I
yeah,
guess we should use the. It would be highly appreciated, and it will requested. We can talk like that
yeah,
instead
yeah.
of please,
So it can be
because please
improved a lot because
please is
people
very
imagine.
simple
Yeah,
language.
imagine. What is your name?
Yes, sir.
What is your name?
My name is Khadija.
Khadija. You are a doctor or nurse?
Yes, I'm sir. I'm nurse.
You are a nurse, okay? And this is doctor's letter. This is doctor's letter. And after taking the class, you know this is not a B grade. If the same letter you get in the real exam and you are the examiner who is going to grade this letter, you will give C grade, okay? C is between 250 to 300, okay? And we cannot
Okay.
imagine if the same letter is written by you and in the real exam you get, 270, 280 like this. You say, they are failing me again and again just so that I keep taking the exam again and they want to earn money and this and that. You are not well prepared. This is the
Yes,
problem
sir.
with you. Yeah,
Actually, sir, according to my point of view,
yeah,
as we are doing jobs in Pakistan, so
yeah,
we in our daily life we use these simple words whenever we are transfer or
yeah,
shifting any patient to another place.
yeah,
So we used this but I guess on international level
yeah.
they don't use like this type of
This is just,
language.
yes,
So
this
that's
is
why
the language
we
of
are
word,
not in
okay?
practice.
Yeah, this is the language of word, okay? That you
Yes,
can
sir.
use when you are writing a call
Yes, sir.
letter,
Yes, sir.
a call
Exactly.
to a surgeon, call to a physician,
Yes.
call to a, urologist, pathologist. We write the language like this, okay? But OET has the criteria. They
What
have,
is it? Yes.
yeah, they have
Yes, sir.
criteria. According to that, the examiners are going to mark your letters, okay?
Yes, sir.
Conciseness, you know, it should be formal, the tone, there are a lot of, things I have a one separate video on my YouTube channel about
Yes,
the
sir.
OET writing assessment criteria, okay? So please improve yourself instead of blaming the teachers and OET so that you can get good marks, okay? So I have my writing and speaking feedback individual classes. If anyone wants to join, you can join. And just, whenever there is free class, try to share the link with your friends, doctors and nurses who are planning to take OET. This can start, learning, and also try to invite other doctors and nurses to join my, WhatsApp community. But it would help you to take, to have the direct messages. Okay. So thank you so much. For the next class, I will update you in my WhatsApp community. Okay. When is the next class? It may be tomorrow.
Excuse me, sir.
I think it could be the reading or it could be, speaking. Yes, any question?
Yes, sir. I have two questions.
Yeah.
Sir, are you covering all modules or just reading or writing
No,
in
I
free
take
classes?
individual classes, that is the paid classes for writing and speaking, because these are the things that need
Right.
feedback. But reading and
Okay.
listening, mostly, this is self-practice. So I mostly take free
Yes,
classes
sir.
for, reading so that I can guide a little bit, I take a lot of reading classes. So I'm planning to take listening classes also. There are a lot of material people already have in the Google Drives and here and there. And those
Yes,
who are
sir.
selling these things at the end, students don't improve with the, these courses, and it give me a little bit, not
Right,
good
sir.
feelings. Okay. But I will take some free classes for listening and reading. Okay.
Thank you, sir.
I have my own, reading samples. So maybe tomorrow we will do a reading class. Okay. So there
In the same time, sir.
I have also a lot of my previous reading lectures that I have in my laptop. I'm going to update them on my YouTube channel. Okay.
Right, sir.
Upload on my YouTube channel. Okay. Thank you so much. I will update about
And
the next class in
excuse
my,
me,
yes, please.
can I see your model answer once, please? A
Yeah.
recent letter.
Yeah. This is the model answer. You can take a screenshot if you want.
Okay,
Yeah,
just
thank you. And can you
sir.
do a little bit down? Thank you.
Mm.
Sir, can I write this letter
Yeah, you
today
can
and
write me
can I
and you can
send you?
send me within next hour, 6 hours. Okay, not more than
Right,
after
sir.
that, because I cannot, keep taking the same thing, for the next, you know, 3, 4 days.
Okay,
Okay,
sir.
so you can send me those who
Bundle
were
of
in the
thanks.
class. You can send me the letter if you want for the feedback within next 6 hours. So I will try to give feedback maybe by voice notes or maybe a written one or maybe just white notes with model answer. Okay, so you can
Right,
send me
sir.
or maybe you can. I will. marking letter at the start of next class, maybe like this. You can send me letter, okay? But only for those who are in the class, okay? Thank you. Have a good day.
Right, sir.
Thank